Wow, I didn't know what to expect, and I'm sort of a bit knocked out at how many people are here. My name's Dave Thompson. I'm the development manager of Access Dorset. We're a charity that's run by our members who are all disabled people, older people and carers. We cover the whole county of Dorset, and it's, like I say, we've got something in the region of 780 individual members, I think. There are also 20 different partner organisations. We're a pan-impairment organisation, so we cover all types of disability. But of those 20 organisations, I won't go through all of them, but just as an example, for instance, Paul Forum, who work with people and represent people with a learning disability. The MS Society in Bournemouth is a member of Access Dorset. So it's very much an informal partnership. We're very much about signposting and sharing and promoting the work of all of our different partners. We also work with lots of other organisations, and like Susie, we work very closely with SEDCAT as well, who provide a fantastic service. But we're very driven by the idea of being user-led, run by our members. We're very much about peer support and self-help. So basically that's central to our philosophy as an organisation. And it's particularly relevant, we feel, in a period of extensive cuts that are just going on and on and on, that we've got to look after ourselves. We've got to be able to speak out for ourselves as well. So in terms of our aims and objectives, we're very much about providing a powerful voice for disabled people, older people and carers, but we're also about enabling and empowering individuals. In terms of communication, we make quite a lot of films. I'm used to being on the other side of a camera, to be honest with you, and I hate being on this side. But what we found was, in terms of our community, people that we're sort of like talking to and inviting them to sort of represent their views, we find that sort of making films, very short films, is a really good way of communicating. I don't know whether any of you know Access Dorset and have seen our website, but there's a series of films on there. There's a series called Patients in Control. That's very much about self-management of health issues. We've also run a big project around Fit for Life, and it's very much a matter of, we make films, we've also got articles in our magazine. Again, some of you might have seen this. This is quite a well-known magazine that's circulated all over the county. The free councils and health take multiple copies to distribute them. So you find them in a lot of health centres, doctor surgeries all over the county. The way we approach things with the magazine, similar to the way in making the films, is we let our members speak out for themselves. And when I say, you don't have to be a member of Access Dorset for us to be representing your views either. But so just as an example, when the magazine first started, we were approached by another voluntary sector organisation from Southampton that organise sailing trips. They're called the Big Sailing Trust, I think they're called. And they asked us if we'd run an article about what they do, because they're very good at organising accessible holidays. And we said, well, we don't really want to run a press release and represent. What we'd rather do is get one of our members who's actually been on one of the voyages to talk about her experiences. And it was actually very popular. So it's the way we tend to approach things. So when we're relating things around health, rather than running like a press release from the NHS, we'd much sooner have one of our members or a number of our members putting something together about how it relates to us. So we're very much grassroots, the way we approach things. As you can see from the pull-up banner, Access Dorset, nothing about us without us. It's a key slogan of the disabled people's movement, and we feel very empowered by that slogan. So it's all about providing knowledge and know-how on how to advocate for ourselves. One of the things that we do, I suppose our core service, is providing information and advice and increasingly advocacy. So that's very much our core service. We cover all sorts of different issues in terms of information and advice, particularly in terms of the changes going on around benefits. We get lots of people calling us with issues around like claims or appeals around ESA, PIP, things like that. We also take a lot of calls or speak to a lot of people around issues around aids and adaptations, we actually employ a couple of occupational therapists, so we run services around that as well.